Good morning or good afternoon, wherever you are, and thank you for joining us today for our first Advocacy Lunch and Learn. My name is Allison Nadeau, and I am the Policy and Advocacy Manager for the ALS Network. In my role, I help drive strategic initiatives that bridge the gap between the ALS community and policymakers. Our work ensures that the voices of people with ALS, their families, and their caregivers directly influence healthcare policy and research funding decisions. I work closely with the entire staff at the ALS Network to ensure that our three mission priorities of care, advocacy, and research are exemplified in our conversations with lawmakers and other healthcare partners and organizations. We are excited to bring you this important advocacy lunch and learn for the ALS community. Today's agenda includes ALS Network Advocacy, a brief introduction to our work, the results from our National Policy Priorities Survey, the 3 policy priorities that came from that data, a live demo of our Advocacy Action Center, and we will end with a Q&A where we will have Audra Hines, the VP of Care and Advocacy, join me. Advocacy, at its core, means using your voice to influence change. Listed on the slide, you will see multiple examples of the different types of advocacy, including legislative, grassroots, media advocacy, and so much more. Depending on the topic or issue, the approach can look very different. Some examples are writing letters to elected officials, sharing your story, attending town halls, educating the public, or mobilizing to take action. Each form of advocacy supports and amplifies the other. For example, grassroots efforts can create public pressure that drive legislative change. Media advocacy can raise awareness about topics and attract new coalition partners. Policy and legal advocacy can offer solutions and enforce protections that help our communities. And educational advocacy helps to ensure that everyone, from the public to policymakers, are informed and aligned. You can think of them as tools in a toolbox, using the right mix for the right moment that can drive real and lasting change. In late 2024, we collaborated with the 14 other organizations that are a part of ALS United to conduct a comprehensive and nationwide survey. The goal was to better understand the challenges, needs, and priorities of people living with ALS, their caregivers, and their loved ones. We were blown away by the response. More than 550 individuals from across the US took part in this survey. A few things to highlight about the demographics include about 14% of the responses were from our California community. Additionally, 83% of all respondents said they currently receive care from a multidisciplinary ALS clinic, which reaffirms how critical those centers are to care delivery. Now, based on everything that we've heard, we've identified the top 3 state and federal policy priorities for 2025. These are the issues that respondents told us matter most to them and where they want to see change. The most highly prioritized issue is expanding research funding and access to clinical trials, which nearly 68% of respondents said that increasing federal funding for ALS research was a top priority. We saw a strong desire to improve access to clinical trials. While only 24% of respondents had participated in a trial, 59% said they would be willing to participate if given the opportunity. That tells us that the interest is there, and what's missing is access. Our second major priority is expanding financial support systems. 64% of respondents support policies like tax credits and other financial relief for people living with ALS and their families. This directly responds to the 53% of participants who said they're experiencing financial hardship. And that hardship spans a wide range of needs, from caregiver compensation and in-home care to modifications for accessibility and covering out-of-pocket disability-related costs. Our last priority is improving healthcare access and coverage. We heard loud and clear that access to care continues to be a major barrier, with 29% of respondents saying that they struggle due to a lack of local ALS providers. And more than 300 people emphasized the need for insurance coverage for new ALS drugs, especially those just coming to market. We saw strong support for policies that improve access through transportation assistance and expanded telehealth coverage. In fact, 44% said that telehealth would make it easier for them to access care. Overall, the 2024 legislative survey revealed both progress and persistent challenges for the ALS community. While most respondents reported satisfaction with their specialty care, significant barriers remain in areas of financial support, geographic access, and research and clinical trial participation. The recommended priorities for 2025 reflect the community's most pressing needs and strongest opportunities for impact. By focusing on research expansion, financial support systems, and healthcare access, the ALS Network can effectively advocate for meaningful improvements in the lives of people with ALS and their families on all levels of government. Our policy priorities are the foundation for all the advocacy work that we do. Now, I'd like to show you how these priorities come to life through our Advocacy Action Center. This is our one-stop shop for getting involved. It's where you can learn about current campaigns, take action on different key issues, and access helpful resources to support your advocacy journey. Let's take a look at our Action Center together, and you can find the URL linked in the chat. Let's see if I can get my lights to go back on in my room. There we go. I'm going to quickly share my screen. All right. So when you navigate to the Action Center using the URL in your chat, you will come to the home landing page. At the top of the screen, you will find the menu bar that allows you to navigate to different pages. If you scroll down the home page, you will find quick access links to share your story, to take action on our current campaigns. You will link to our calendar of events, and then you can learn about our most recent advocacy win in California when Assembly Bill 511 became law in 2024. AB 511 created the California ALS Research Network Voluntary Tax Contribution, where Californian taxpayers can support the search for effective treatments and cures for ALS and help better understand related neurodegenerative diseases. We're going to scroll back to the top where you can sign up to become an advocate. You will click the sign up button on the top right-hand corner. Once you fill out the form with your information, you will be added to our email list where you will receive updates on current political events, opportunities to get involved, and action alerts. So I've pre-input my information. I'm going to hit the submit survey button. And so now you will see that I am officially an advocate. Quorum will auto-populate your legislators based on the information that you put in the Become an Advocate tab, where you can see under your legislators. Now I will quickly walk you through our current action alerts. If you go to take action, you hit the action alert button. We have 3 live federal campaigns in our Action Center, which can be found under this tab. The first action alert that we're going to talk about is titled Protect ALS Research. You can see that Quorum auto-populated my constituents or my legislators because I filled out that form. If you had not done so already, you would need to fill out the information that would live here, which will get you to this screen. Once I hit the submit button at the bottom, Quorum will send a letter directly to my respective legislators. The NIH recently announced a new policy to cap indirect research costs at 15%. Apologies, my light went out again. There we go. We shared this information with you all through social media and other communications and asked for advocates to reach out to their members of Congress. Fortunately, the policy faced immediate legal challenges. A coalition of 22 states filed lawsuits arguing that the cuts would cause irreparable harm to medical research. In response, a U.S. district judge issued a preliminary injunction on March 5th, halting the implementation of the NIH's policy pending further legal proceedings. As of today, the NIH's attempt to cap indirect cost reimbursements at 15% remains blocked by the court's injunction, maintaining the previous negotiated rates until a final legal resolution is reached. So I'm going to go to our next action alert. Again, take action, action alerts. The next action alert we will discuss is to protect the Congressionally Directed Medical Research Program, also known as the CDMRP. Congress passed the continuing resolution, also known as a CR, to fund the government. The CR included significant cuts to the Department of Defense's CDMRP program, including severe reductions to the ALS research program. We asked our community to reach out to their members of Congress to oppose these cuts before passage. Due to the powerful advocacy efforts by advocates and our partners, the ALS research program remains budgeted at $40 million for fiscal year 25. While this funding level is intact, it is not guaranteed, and we must continue to advocate to ensure that it remains. The decision to cut CDMRP funding is unacceptable, and we can't afford to halt research now. However, of note, the CR did extend the Medicare COVID-19 telehealth flexibilities until September 30th, which is a win. I'm going to go back to our action alert page and look at our final, which is on a positive note. You have an opportunity to support family caregivers. On March 11th, the House Ways and Means Committee members, Congresswoman Linda Sanchez of California and Congressman Mike Carey, along with senators, introduced the Credit for Caring Act of 2025. This is a bipartisan bill that would provide relief to caregivers through a federal tax credit of up to $5,000 for eligible caregivers to help with the financial impact of caregiving. You can help support family caregivers and ask your member of Congress to co-sponsor this bill by taking action. If you have not done so already, feel free to join us in reaching out to your members of Congress after this call and take action on the different live campaigns that we have. In addition to these action alerts, the ALS Network recently joined 29 neurodegenerative organizations in signing a congressional appropriations letter requesting continued support for the ALS programs, including $80 million for the CDMRP program we just spoke about, which is a $40 million increase from the FY25 in the CR. It was shared with our members of Congress and Appropriations Committee. You can view the entire letter on our website by clicking the public policy option like I did up here, and then FY26 funding. Additionally, you can see the full letter by clicking the Here button, and then this is the exact letter that was shared with Congress. We also invite you to share your story, which you can find in the Take Action section, and then click Share Your Story. Telling people about your personal experiences can help raise awareness and inspire others to get involved. This can also influence decision makers to push for advancements in treatment, improvements in access to care, and increase research funding. Whether you are a person living with ALS, a family member, a caregiver, a healthcare professional, or just a concerned individual, your story truly makes a difference. I'm going to stop sharing my screen, and I will invite Audra Hines to join me as we move into the question and answer portion of our presentation. Please post any questions you have in the Q&A function at the bottom of your screen.
Hey, Allison, happy to join you. Glad everybody's with us today, brown bagging it. Yeah, as Allison said, that was great, Allison. So much great information. So happy to have you in this role with the ALS Network. Allison is our first policy and advocacy manager for the organization. So this is great. And we're really building out and expanding both for California and Hawaii. It's a really exciting time. As she said, yeah, if you have advocacy related questions, we'd love to answer them. Just type them into the Q&A function at the bottom of your screen. And Allison, I know we had a couple of questions ahead of time. We could probably tackle those while we wait to see if anyone else has any. I see one about telehealth. Telehealth was mentioned as a key way to improve access to care, especially for people who don't live near an ALS clinic. Just thinking about what policy changes are needed to make telehealth more widely available and sustainable. Do you want to take that one?
Yeah, absolutely. That's such an important question, especially for people living in rural areas or for those who face mobility challenges. Right now, telehealth access for Medicare beneficiaries is still tied to the temporary flexibilities that were in place during the COVID-19 pandemic. They were recently extended, like I mentioned, through September 2025, but they're not permanent. Fortunately, the ALS Network recently joined the Telehealth Access for America Coalition, that's primary focus is protecting and expanding access to telehealth. To make telehealth a long-term solution, we need to pass legislation that removes the geographic and site restrictions permanently. That also means allowing people to access telehealth from home, regardless of where they live. And we need to ensure that audio-only visits remain an option for those without strong internet access, and that providers are fairly reimbursed for telehealth as well. Protecting and expanding access to telehealth has strong bipartisan support in Congress, which is a huge positive, and is championed by patients and healthcare providers across the country. In coming months, advocates can have a real impact. We will be collaborating with coalition partners and we'll call on our advocates to contact their lawmakers and members of Congress and share how telehealth has made a difference. And that is where sharing your story is going to impact this priority. Stories like that help drive policy change.
Yeah, that was well said. And I think just as Allison she's talked a lot in the last few minutes about sharing your story. It's pretty critical for us as an organization, not just to build our pool of advocates and have people working in synchronistically with us on these issues, but telling your personal story really does help us when we go to the Hill in DC, when we go to Sacramento or Honolulu in Hawaii to really try to push forward priorities that are important to people living with ALS. So the stories are always great. As we wait to see if anybody else has questions, we have one more. I love this question actually. We know that advocacy can feel intimidating to people who haven't done it before. We know that. What advice do you have for someone who wants to get involved but isn't sure where to start? Allison, you want to take that one too?
Absolutely. I think that the good news about advocacy is that it doesn't have to be complicated or time consuming to be really powerful. It can be as simple as clicking a button to send a pre-written message to your elected officials through our Action Center, which I showed you earlier in this call. That alone makes a difference. If you want to go a step further, I'm reiterating what Audra said, consider sharing your story with us. You don't need to have all the answers or be a policy expert. Like, we have people to do that, you know? What we need is you just being willing to speak up about your lived experiences or caring for someone with ALS. It's incredibly powerful. And remember that you're not doing this alone. We're here to support you every step of the way with tools, templates, guidance, resources. So start small and know that every action, no matter how big, no matter how small, adds up to real change. And we're here to help you.
That's great, Allison. Thanks so much for that. One question we did receive, this is really important. Should we still take the CDMRP action or the NIH indirect cost actions, or those issues solved? Far from being solved, and I'd love to hear what you have to say too, Allison, but these are real-time issues for us that, even though, as Allison mentioned, there is still some funding intact for the CDMRP, we know that it's not enough, frankly, and that it also could go away by later this fall. So that action is very important. And even with the NIH indirect costs, while that's perhaps held up from a legal standpoint in a court right now, it's really timely, it's really important. And we know that those funding cuts don't just impact ALS. impacts anything from Alzheimer's to cancer to infertility issues to anything that you can imagine that might be research funded right now, is really under that umbrella, and it's quite at stake at this point. Allison, anything to add to that?
I think I would just say that there is so much going on right now at a federal and state level, and it's really important for your members of Congress to hear from you because you are the ones who put them in office. They were elected and got a job because of you. And your opinions and things that you care about really matter. And so if it is reiterating something that they've already heard, there is no harm done in knowing that the people that voted for them feel strongly about an issue and want it to turn out in a certain way. So it's never a bad idea to tell your member of Congress how you're feeling. I have a funny story actually from the other day. I was getting my taxes done, and the lady who was doing my taxes, the government came up and we were having a conversation, and she told me every Friday morning on her way into work, she calls her member of Congress and filters between them and just tells them what she thinks and what she wants to get done. And this is someone who doesn't or isn't affiliated with an advocacy organization and just feels strongly about letting them know what she thinks and what she feels. And I think that is a great example of just they're elected by us, and make sure they know what you care about. And if we can minimize the barrier to doing that, please utilize the resources that we have. And if you have any further questions, please do not hesitate to reach out.
Yeah, I love that, Allison. It's great. One more question that came in. This is interesting. Asking if the ALS Network might find it beneficial to host a learning session to assist caregivers on how to navigate complex health insurance issues and other medical complexities. It's a really good question. It's something in the past that we've certainly had a caregiver focus in the past, but perhaps not necessarily on health insurance issues. I know our large team of care managers throughout California and Hawaii help people navigate this kind of stuff every day and suggesting different community resources for that. But I think we're going to take this under advisement too as a potential topic for the future. So really appreciate that feedback. And then just another note from someone interesting. Communications from constituents are important. So to Allison's point she just made about somebody calling their congressperson, it's great if they really can hear from constituents who live in their district. Form letters are often disregarded. Personal calls and emails are better. Yeah. Allison, anything else on that one?
Fortunately, when you use the Action Center and you hit the submit button on the action alert, it will send an email directly to your respective legislators. So it covers that as well. And one of the nice things about the Action Center is it will populate on a local, state, and federal level all of the people who represent the area that you live. And so that's a great place to go and get information to know who you want to give a phone call if that's something that you're looking to do.
Mm-hmm. That's great. Another great question. I see the letter you shared that so many organizations signed on to. Are there other collaborative efforts happening on the advocacy front? Quite a few, especially with our ALS United partners throughout the country. Allison and I meet with them at least every other week to talk about, particularly on the federal level, just from a commonality that we're all working the same mission, the same goal. We really want to be pretty synced up, not just on federal, but on state issues as well as relevant. And I know we're a part of some coalitions too. Allison, do you want to just talk about that for a minute too? I know you mentioned the telehealth one in your presentation too. I'm thinking of a couple others.
Collaboration is key. I think especially when we are trying to make a big impact. And like Audra mentioned, we meet with ALS United pretty regularly, and we have also seen a partnership with a lot of the other national ALS organizations that serve and have resources in different areas. We are also working closely with under a coalition called Cures Collective, and that is not just in the advocacy space, that is throughout our mission pillars to make sure that we all know best practices, impact of different programs that are in place, and just making sure we have the best information to serve the community to the best of our abilities. Another is in the state of Hawaii. We are working with an organization called the Kapuna Collective, which is focused on the aging adults in Hawaii and the different resources and programs available to them. And while that is not just ALS focused, I think it brings together a wide array of stakeholders that have resources and education and information that can help all the different organizations caring for the kapuna in the state of Hawaii. And then we have Family Caregivers Coalition in the state of California, which focuses on, obviously, as the name mentioned, caregiving. And that one really brings together, again, a wide array of stakeholders. And it is important that we have relationships and partnerships with people outside of the ALS community, because it is not, there are so many issues that impact more than just ALS and the neurodegenerative community. And if we're all working together for the same goal, it really helps to make sure that the people who make decisions know what these organizations and these communities want and need to live happy and healthy lives.
That's great. That's great. I'm thinking too, Allison, about our partnership with the Association for Frontotemporal Dementia. Just knowing that a small percentage of people with ALS have a co-diagnosis of FTD and that type of dementia, and that's been a terrific partnership for us. More recently, another question: if we identify an advocacy need or opportunity in our local community, can ALS Network help with analysis, strategy, and tactics? Do we do local advocacy or just state and federal? That's great. Allison, you want to take that one, or I'm happy to dive into?
Audra, why don't you start and I'll add in.
Yeah, I think that absolutely, we're certainly not relegated just to federal and state advocacy, but I will say I think local advocacy is a place where there's so much opportunity for growth for us. And I think especially in some of our larger urban markets, Los Angeles, the San Francisco Bay Area, of course, Honolulu as well. We are focused on sort of starting with those and targeting those, but really anywhere within California and Hawaii, if you're living somewhere in these two states and you know of something happening locally, that's within your district, just within your area, and you think that this might be important to people with ALS or their family members, we want to hear about that. And again, especially if you're a constituent, because again, we're looking for the stories, we're looking for more advocates, and for you to be the one to reach out to us with something local that might be going on. If it's a city council meeting that's coming up that has something on their agenda that might be tied to caregivers or health or rare disease, we definitely want to know about that, and we'll often show up. We'll show up with you, or we'll be there and give you the tools that you need to participate in that type of work too. So lots of opportunity for growth, and I do think we're just getting started on the local side.
I just want to add that as we start to really build out our local engagement, something that I am hoping to get up and running is creating smaller localized advocate calls where we can talk about what's going on and find ways to either get together or make an impact on the local community. And if you have any ideas, like Audra mentioned, please don't hesitate to reach out to me, because it is something that we are constantly putting our brains together to brainstorm on. And what's important to you all is what's important to us. And if it makes sense, then we'll make it happen and get it done.
I love it. That's great. I don't see any more questions. This has been terrific. This is the first one of these lunch and learns specifically tied to advocacy that we've done, and really appreciate the participation. Wait a minute, there's one more question. There's so much going on right now in our country, and it feels a bit overwhelming to keep up with it all. Will you keep issuing action alerts to keep us focused? Good question, Allison.
Absolutely. As you mentioned, there is a lot going on. So there are some things that might not directly impact the ALS community that may be important to you, but we may not be able to cover. A lot of the action alerts that you will get will cover the things that impact the ALS community directly and can make an impact. And a lot of our partners are also doing similar efforts and making sure that it is an echo chamber of voices in the federal space. So we will continue to make sure that you have the right information when you need it and have the tools to reach out to your legislators and make sure that it's in a way that is understandable, because a lot of the stuff that goes on the federal level is super complex and can be hard to understand, even for the people that are in the weeds and are policy experts. We're here as a resource to keep you up to date and to know what's going on. And if you do have further questions, I feel like I'm a broken record, please feel free to reach out to me. I am happy to talk it through with you as well.
Yeah, that's great. And the only thing I'll add is, we're so committed to getting the information out to you all in a timely way, and we act with urgency here in so many ways. And I think as soon as you see that action alert, it's usually tied to some time sensitivity sometimes. So as soon as you're able to jump on that and really help us by taking action, and as Allison showed you, it's just a few clicks. It doesn't take very much of your time, and it's deeply appreciated by us and by this ALS community. So, well, thank you. We have a few more slides. Hold on, wait. There's one more question. No, this is a comment. This is great. I just want to comment. I really appreciate your alerts and emails. I've shared them out on my social media channels and have found that a lot of my friends and family members are so grateful, even if they don't have an ALS connection. It gives them something to do to help protect ALS research. So, and I think that's right. Easy to reshare on social media too. And our marketing department helps us stay on top of creating a lot of those posts so that people can easily just reshare or pass that along to the people that they care about. Great. Well, I think we have just a few more slides. I really just want to thank everybody for being here. Thank you so much for joining us. We're grateful to each of you for your time and your commitment and just for being a part of our community. If you have other questions that weren't answered, please email Allison at the email address on the screen. And join the ALS Network virtually at the 2025 Community Summit hosted by IMALS on May 7th through 10th in Washington, D.C. The in-person portions of this are pretty full, but they do offer a virtual option. And we're proud to sponsor and participate in this event with other ALS community advocates to learn, to connect, and to mobilize. So please do register to attend if you can join us virtually. As of January 1st, this year, the California ALS Research Network Voluntary Tax Contribution Fund allows Californians filing their state income taxes to donate an amount of their choice to help fund ALS research. This was signed into law in September 2023, and it enables the establishment of a potentially stable funding source to support the work of our California ALS Research Network. Excuse me. Please find code 447 on your tax form to contribute, as we're in the middle of it. Tax day is quickly upon us. The ALS Network brings our community together in various ways throughout the year to create help and hope for families impacted by ALS today and for those who will be diagnosed in the future. These are celebratory and meaningful gatherings that provide opportunities for connection and raise awareness and funds to benefit ALS Network's mission priorities. Please visit events.alsnetwork.org to learn how you can join us. And as you know, philanthropy fuels everything we do, and we're grateful to generous donors who make gifts of all sizes throughout the year, including contributions through an estate plan and many other different vehicles. To learn more about how you can support valuable programs like this one, please visit our website at give.alsnetwork.org. And please do watch for the short survey on this presentation that you'll receive in your email to help us plan for future programs. Thanks so much again, and we'll see you next time.